Like our panelists and Dr. Dheeraj Tripathi pointed out, there are certain places in our clinical repertoire, in our clinical situation for tips as a management in our management repertoire. Certainly, variceal bleeding is a good one, but I would readily admit to the logistical challenges which Dr. Dheeraj pointed out. In fact, we have a patient in our ICU who's actually bled, but he's got such severe renal dysfunction that we're not able to image him properly. So how would you actually plan a tips in him? That's a big logistical nightmare, really. And like our other two debaters have discussed, there is a role of tips in selected patients. Technique is important, and obviously discussion in a multidisciplinary team is vital, especially with liver transplant with the liver transplant surgeon and hepatologist. So I think we've learned a lot during this session, especially regarding patient selection and techniques. And I'd really like to thank Dr. Dheeraj, and Dinesh and Dr. Madhavan for a lively discussion. I think Dr. Mallikarjun is back here. Maybe I could just ask him if he can. Matthew, do you want to just ask him if he wants to pass any final comments? I can see him on the screen now.
Well, I don't think he's online.
Okay.
Anyway.
Okay. So it's frozen in time. Okay, then. Thank you all for a good debate, good discussion, and give it back to Matthew to thank them all. Thanks.
Yeah, I'd just like to thank all the participants as well. There are plenty of questions. We'll certainly answer each one of them individually. Due to shortage of time, we couldn't take all of them, and it was a very lively session with great audience participation. And thank you, eminent speakers and colleagues.